I'm Karen Sukni for Take 5 Video with Healthcare Packaging. At this point, it's become widely accepted that the healthcare industry as a whole can no longer ignore its environmental impact. Now, of course, there are folks, including but not limited to the Healthcare Plastics Recycling Council, who have been working on sustainability in the packaging community for years. But healthcare has kind of long been exempt from the discussion when it comes to single-use plastic bans, taxes, and extended producer responsibility. But this is beginning to change with regulations coming out of Europe. DuPont's Terry Wagner recapped those in an article, Emerging EU Sustainability Regulations for Packaging, which we'll link to below. Now, it's nerve-wracking to think about regulators outside of the packaging community creating laws that could affect a validated medical package and potentially patient safety. We've also seen on the consumer side that sudden switches to industrially compostable materials without consumer access to composting sites can really complicate things and sort of stray away from the intended laws. So while action is necessary, regulations need to take into account practical considerations, such as the true end of life of a package. Now, the good news is that EU regulators do seem open to feedback from the life sciences, and they recognize that patient safety is paramount. At the virtual medical packaging conference in October, Wagner noted that the Packaging and Packaging Waste Directive, or PPWD, there's a clear rule which allows regulators to make implementing decisions. So rules that will apply to other types of packaging wouldn't necessarily apply to medical and pharmaceutical packaging. Now, in terms of integrating recycled content into packaging, this is something we're seeing on the consumer side in personal care, cannabis, and more, with the use of post-consumer recycled or PCR content, and in some cases, the specific use of reclaimed ocean plastics. Wagner pointed out that medical packaging can be a great source of recycled content as well. These life science packages are composed of high-quality polymers. They're great source material. So it's important for the community to figure out the logistics of contributing material to be repurposed. But as Wagner said, he believes that for integrating recycled content into healthcare packaging, we'll have to wait a bit longer from the maturity of these emerging technologies due to the EU MDR and FDA rules for controlling risks. Now, you can only make sure that you're meeting those requirements if you have traceability of those streams and if you have flawless quality control. He says eventually it'll come, but the push is there, but it will take some time. At the virtual medical packaging conference, Amcor's Dr. Isabel Jenny said that while PCR content coming from mechanical recycling isn't used in food, pharma, or medical packaging, she said there's promise in advanced recycling that one day may be used even in these highly regulated applications. Amcor recently launched one of the first food packages containing advanced recycling recycled content, and that material is used in a chocolate flow wrap application. So advanced recycling recycled content is starting to be implemented in food packaging, and a next step, pharmaceutical or medical packages are likely to be assessed for use in this material. In mechanical recycling news, Wagner pointed out a project where DuPont upgraded their mechanical recycling processes for internal recycling of pre-consumer waste. Some of these recycled materials go into non-healthcare applications, but they also use recycled Tyvek for the manufacture of plastic cores to wind Tyvek sheet material in production. This is something that we'll continue to see more of, and it's a long-held principle of lean manufacturing. Companies are just getting more creative about internal processes for reducing waste and bolstering reuse. That's all for today, and we'll see you next time at Take 5 Video for Healthcare Packaging.